Good day everyone, my name is Lady Suzanne Pigabel from BSN1 Batch 1. I'm here to give you an overview about my case study, the broadfish tapeworm or the Diphyllobothrium latum or the D. latum that has 14 species that can cause a disease called the Diphyllobothriasis, and that Diphyllobothriasis can be attained when you eat raw freshwater fish or cooked or naturally cooked freshwater fish that is infected by that certain tapeworm. So this infection or the Diphyllobothriasis infection is also considered as a public health issue for residents and travelers in endemic as well as non-endemic regions. The fish tapeworm D. latum has historically been implicated in human illness for thousands of years. The current state of knowledge regarding this parasite points to cohabitation with humans since the early Neolithic period. So, these parasites usually exist or known for the past few years. So in Neolithic period, so epidemiologic studies have included that in 1970s there are 20 million people currently infected worldwide. So this infection has infected 20 million people worldwide. Pathophysiology. The life cycle of D. latum as it relates to humans begins when unembryonated eggs are released into the feces of humans that were infected with the intestinal parasite. These eggs will become embryonated in water under appropriate conditions, with the process usually lasting 18 to 20 days. So this parasite is an intestinal parasite. During this maturation process, oncospheres, which are the first larval forms of the tapeworm, so oncospheres is the first forms of a tapeworm, materialize within the egg. The oncosphere is then covered by the outer envelope that contains cilia and is called coracidium. This coracidium hatches from the egg in the surrounding water and becomes a free-swimming larval stage. So like the egg of a frog, it becomes on the stage of larval stage, and it can usually free swim in the fresh water area. Then free swimming coracidum is consumed by the first intermediate host. This usually is an aquatic arthropod such as the crustaceans from the subclass Copepoda. Next, within these copepods, the second larval stage of D. latum develops, called the perocercoid. This occurs through a complex host of interactions where the coracidum penetrates the intestinal wall of the first intermediate host. So in that stage, the procercoid will destroy the stomach of its first intermediate host. This procercoid stage contains 6 embryonic hooks in its posterior appendage, which helps to anchor it. Then the infected crustaceans is ingested, usually by freshwater or marine fish. This second intermediate host now takes over as the site of further larval maturation. So it is passed by the crustacean to the freshwater or marine fish already. Then the ingestion of copepod allows the procercoid larvae to be released, and they migrate to enter the tissues of the second intermediate host. So in this stage, the tapeworm is finding its new intermediate host. because they are done destroying the first one. So, order to develop into the third larval stage, called the plerocercoid. This is the infective stage of the larvae. And when the smaller second intermediate hosts are consumed by a larger fish, the plerocercoid will migrate to the musculature of these larger fishes. So, it's transmitted to the larger fishes na. Then human transmission occurs when humans consume this raw or undercooked fish that are infected with the Dilatum. So that's the life cycle of the Dilatum or the Diphyllobothrium latum or the broadfish tapeworm. In humans, the plerocercoid develops into mature tapeworms which attach and reside in the intestine. So it will live in the infected human's intestine. The fecundity, which is the reproductive potential of these tapeworms, is extremely high, and one tapeworm is estimated to produce up to 1 million eggs per day. So it can produce 1 million eggs per day. Once established, the tapeworm infection is postulated to induce changes in the concentration of several neuromodulators in the host tissues and serum. Dilatum infection has been shown to cause structural changes locally, leading to altered gastrointestinal tract functioning by modulating the neuroendocrine response and causing enhanced secretion as well as changing gut motility. Studies have shown that the damage caused by these infections are also mediated through induction of mast cell and eosinophilic granule cell degranulation, leading to release of inflammatory cytokines. Infection with Dilatum has also been shown to lead to anemia, secondary to dissociation of vitamin B12 from its intrinsic factor complex in the gut, which is due to faster absorption of rate of B12 by the tapeworm relative to the human gut. So, this infection also causes anemia, and this infection also, or this parasite also, will faster to absorb the B12. So the human host will lack of the B12, so that will cause him to be ill. So histopathology, Dilatum is the longest human tapeworm. So Dilatum, Diphyllobothrium latum, is the longest human tapeworm, and it's typically 4 to 15 meters. So can you imagine that tapeworm that long inside your body in length, but can grow up to 25 meters. So the minimum of its weight with its height is 4 to 15 meters, but it can usually be longer than that and turn into 25 meters within the human intestine. The rate of growth may exceed to 22 centimeters per day, and they may remain active in the gut for over 20 years. So they can live in your stomach for 20 years. The Dilatum is characterized by an anterior end called the scolex. The attached grooves on its dorsal and ventral surfaces. The body of the tapeworm is composed of many segments, each containing sets of male and female reproductive organs, allowing for its high fecundity. So that certain tapeworm is really is up for survival inside the host body. It can grow into maximum of 25 centimeter. Diphyllobothriasis can affect different organ systems, which varied manifestations and are listed. Central nervous system. Manifestations include paresthesia, demyelinating symptoms secondary to prolonged anemia, and vitamin B12 deficiency can cause headaches and encephalopathy. In the ocular, manifestations include optic neuritis secondary to long-standing vitamin B deficiency. Gastrointestinal manifestations include acute abdominal pain, diarrhea, constipation, intestinal obstruction, subacute appendicitis, cholecystitis, as well as the cholangitis. Hematological manifestations include megaloblastic anemia, vitamin B12 deficiency, pancytopenia, eosinophilia, and pernicious anemia. Usually focuses on anemia and vitamin B12 deficiency. Respiratory manifestations include dyspnea in the setting of severe vitamin B12 deficiency. Dermatological manifestations include glossitis and allergic symptoms such as well as pallor. So the treatment and management of the parasite. Treatment for the parasitic infection as well as the most tapeworm infections is the praziquantel in those without contraindications. A 25 milligrams or kilogram dose is noted to be highly effective against Diphyllobothrium latum infections. Lower doses at 10 milligrams or kilograms have been noted to be effective against other species of Diphyllobothrium, but have shown poor efficacy against D. latum in experimental animal models. A single dose was found to have high cure rates. Side effects of praziquantel include weakness, headaches, dizziness, abdominal pain, fever, and possibly urticaria. An alternative anethylmethric drug used for D. latum infections is a single dose of niclosamide, which is given either in a single 2-gram dose for adults and a 1-gram dose for children older than 6 years of age. Praziquantel can be given in pregnancy. So the main treatment or medications for the treatment of this tapeworm or tapeworms is the praziquantel and the noclosamide. Praziquantel and the noclosamide. For the prevention and control, the best way to prevent infection with the Diphyllobothrium latum is to avoid consumption of raw fish. Food safety practices include cooking the fish well or freezing fish at -18 degrees Celsius for 24 to 48 hours to prevent infection, so that the tapeworm will die or freeze or burn or be burned. Pearls or other issues. Diphyllobothriasis is caused by the fish tapeworm D. latum, an zoonotic infection usually attributed to the consumption of raw or undercooked fish. Diagnosis relies on thorough patient history, asking about occupational history, habits, travel history, eating habits, as well as maintaining high index of suspicion. Most infected individuals present with mild illness characterized by abdominal pain and discomfort, diarrhea, and malaise. The laboratory testing is largely non-specific but may reveal eosinophilia as well as the vitamin B12 deficiency, megaloblastic anemia, and pernicious anemia. In summary, the Diphyllobothrium latum can cause Diphyllobothriasis infection that can be attained when you eat raw fish or undercooked fish or unfreeze fish from fresh water area. And that certain tapeworm can be long enough, like 25 meters. It is also the largest tapeworm found in intestine of the human body, and can cause a lot of symptoms like headaches, vomiting, stomach aches, and is also can be found worldwide and can infect at any ages. And it is very alarming because the distribution of it is through fresh water. When you eat freshwater fish that is uncooked or not thoroughly cooked or not freeze, then the life cycle of it is very short enough, like 18 to 20 days. Then the medications, you can usually buy medications without a prescription. So for me, as a future nurse, we must be careful of what we eat. We must make sure that our meals or the food that we eat is cooked enough, cooked and well cleansed and freezed before eating, as well as we can share it to other people so that the cases of this tapeworm infection can be lessened and lessened day by day. So that would be all. Thank you for listening, and God bless. More power.